So from now, I will talk about the abnormal positioned implant processes. Okay. So we cannot position implant properly in severe bone loss like this. So how can I make the final prosthesis? So this case referred from the Pusan National University. So today I will show the newly developed prosthetic system. So Pusan National University professor knows the new system, so he referred to me, and then I solved these problems. Anyway, after making final prosthesis, the patient cannot clean in these cases. No? So I will show how we can change our treatment protocol. So I will read this sentence. This sentence is written in this article. It's very famous article. So in considering patients that have a history of periodontal disease, not peri-implantitis, periodontal disease, have oral hygiene limitations due to physical disabilities, or who suffer from low dental IQ, or who are simply non-complicated, an implanted prosthesis purposely designed to incorporate a smooth surface of color and or supragingival abutment platform interface may prove beneficial for long-term health and successful maintenance, supportive periodontal therapy procedures in these at-risk patients. So, at-risk patient, this term is very important. So we have to distinguish at-risk patients. So first system is the Easy Crown systems. I developed this system 7 years ago. So nowadays, China and Korea are using these abutment systems. Now I'm proceeding the FDA approval nowadays. So maybe two months later, this product can be used in America. So this very complicated structure, but many companies are mimicking this product nowadays. So do you know the Neobiotech company? So they developed the YK Link abutment. So the owner of Neobiotech companies always said in his lectures, I followed Dr. He's concept. Yes, anyway, but those kind of systems has short-term follow-up, but this system has already 7 years old follow-up. So I have many clinical researches about that. So I have convinced about this introducing of this system. So to create an environment that may be predisposed for health, one should consider all of the various implant and restorative factors related to the hygiene, maintenance, and retrievability, as well as aesthetics. I show you this complication chart. So anyway, recently there are many complications in dental implant. Peri-implantitis because of the residual cement, the fracture of the texture, the screw fracture can be occurred frequently. So I want to remove those kind of screw. And then if the dentist want to remove the final prosthesis, I think that this procedure have to be simple. If you hit the prosthesis can be put out simply. So this system was developed focusing those kind of factors. So I want to review the previous concepts of final prosthesis, implant prosthesis. Do you know, we are following the concept of development from the 1970s, from the Brandemark or Astra implant. Now we are living in 2023, but we are following the 50 years ago's concept. Why we have to use the same abutment, same screw? So I can understand about it. So anyway, in the textbook in South Korea, the students are learning the implantology in school. The teacher always divide like this: screw retained restoration, cement retained restoration, combination type restoration. Combination type means the combined with screw and cement retained types. So look at the concept image. So cement retained types connect the abutment and then seal the hole and then cement with the cement attach with the cement like this, and then remove the residual cement in oral cavity. All right. Screw retained type make the one body implant prosthesis and then connect with the picture with the screw. But nowadays we have to use zirconia. Zirconia cannot make the one body types prosthesis, right? We cannot cast. Yes, we always have to build the zirconia block, and then we have to bond with between the zirconia crown and the abutment. So it's impossible to make those kind of things. So the combination type restoration was developed like this: abutment connection and the wholesaling, and after final cementation with the resin cement, and then remove this crown and then clean, right? Because we are using the zirconia or other materials for making the final prosthesis. And we have to consider the compensation of the angulation of pictures. You know? So now definitely you are using submerged internal connection type implant, right? Everybody? Is there anybody to use the external connection? No? Yeah. Anyway, if you use the internal connection implant, the compensating angle is only 22. If the implant inserted tilted each other, you cannot put inside the final prosthesis to the picture if the angle is over 22. 22 degrees is for non-hexed abutment. If we use hexed abutment, the angulation can be compensated about 11 degrees. No? So you have to use the convertible abutment or multi-angled abutment like this. This is the highest end product. But many implant companies developed those kind of compensating, angle compensating abutment nowadays. But if you use the external connection types, you can compensate over 40 degrees. So in my case, I like this implant. Yeah. Because it's very easy to make the pinal prosthesis without any disturbance of angulation. But I believe you are all cemented type, right? Cement type, you all use cement type nowadays. So it's easy to obtain passive fit between the implants of the large allowable range of angle, compensation, and cement space. But that also have some problems. We cannot remove the pinal prosthesis. If we use a temporary cement, the pinal prosthesis pull out easily. Whenever the patient, the sticky pulled, the crown can be pulled out. So anyway, I wanna change those kind of concepts, because we are not necessary to follow those kind of previous concepts. Okay, I will pass. Especially according to the prosthetic material, the needed space will be different. You know, if we use the gold crown, you need only 1.5 millimeter thickness on the occlusal surface, and total height will be need only about 5 millimeter when we use the cement type abutment. But if we use gold crown and then if we use the screw type, screw retained processes, the vertical height will be needed only 4 millimeter. But if we use the zirconia, you need about over 6 millimeter space. So anyway, according to the materials, you cannot use the zirconia final processes. Look at this. So those kind of conditions, you cannot cement type, you cannot use the zirconia. So you always use the gold crown by the casting procedure. If you use the custom abutment like this and then make the retentive form like this, but it's very difficult to maintain this crown, especially the emergence profile and the contour of crown have the ugly form, right? Yeah. So it makes those kind of ulcer or swelling around the final processes. Especially the big problem is the residual cement. So when you use the cement type, after insert the abutment, and then you have to remove the residual cement in the oral cavity. But in case of resin cement, we cannot detect at the first time. After 1 or 2 months later, we can see the changed colors of the resin cement like this. So after removing the final processes, we can see the residual cement like this. So many articles suggest the different method to reduce the residual cement, but it's very difficult to completely remove it. The hole is also problems. This is screw hole. When you use the zirconia crown, you always use the combination type processes. Combination means it's look like a screw type, screw retained processes, but you have to cement this final processes to abutment with resin cement. You know, that is the combination type. In Korea, we can say SCRP type. S screw, C cement, R retained, P processes. No. Anyway, regardless the types, we always make the screw hole in this part. So it make the non-aesthetic pictures of the crown. And especially we cannot give the occlusal contact point in this part. This screw hole is so big, about 2.5 millimeter, 2 millimeter, about 2 millimeter. But for getting the retrievability, we have to make the screw hole nowadays. So sometimes we can beat those kind of fracture of screw and then inflammation around the crown. At that time, we have to remove the final processes, but it's burden procedure, you know. We have to remove the resin cement on the hole and then remove the sealing material and then loosening the screw and then pull out the final process and clean and then treat the soft tissue and then you have to put again, you know, and then retightening and then put the sealing material and then put the resin material. I think that it's so burdened. Whenever I want to remove the crown, I want the simple procedure. After hitting of the crown have to pull out. And then the patient bite the final processes. The final process can be attached automatically. This system is the easy crown systems. So similar product have been developing many companies. So wrapped one is the low-dose abutment developed by Straumann. The Straumann companies bought the low-dose company, a very small venture company in America. So anyway, in the UCLA tested this product. But until now, it's not launched because it has so expensive price. So we need insert the specific link inside of the abutment, and then we need the hole in the lingual part. So the metal is the memorized metal. That means after deformation, the heating give the deformation go to the original form. Yeah, that kind of thing is memorial material, metal. So in this hole, to remove the crown, they put the dedicated devices and then give the heat to the metal. Do you understand? Yeah. So anyway, very complicated. So this product developed at a similar time with my product, my developed devices, but until now it was not launched until now. Have you seen the fixed hybrid prosthesis in locator? This product called locator FTX. Do you know that? So it's similar with locator. After insert the peri-implant, and then make the pinna prosthesis with PMMA resin, and then attach the attachment with the plastic. So this product has some limitation. You have to make with PMMA, not zirconia. And then if the patient have the heavy bite force, the male part or female part will be wear easily. So sometimes we can see the fracture on this part. So in Korea, the patients have the heavy bite force, so we cannot use this product. But nowadays, many distributor is selling this product in America. I heard that. Third thing is the product using the friction abutment, and there is the fixed cap, friction cap, and then the cap is connected with the pinna prosthesis. So without screw, it can be inserted to the abutment. But after wearing the friction, there is no retention. No. Anyway, those kind of systems have been developing in many countries. Oh, not moved. Anyway, this is easy crown system. So this is a picture. This is one body abutment. Nowadays, I'm developing the combined picture with this one and this one. I like tissue level implant. I don't want to make the gap between picture and abutment, but to use another picture product, I separate this abutment and then picture. So, and this is the dedicated cap for each crown, and then the crown. The upper thing is the zirconia crown. So in the lab, the zirconia crown will be cemented with this cap with the resin cement, and then in clinics you can push only push pores. You can enter this crown to this abutment. So I want to skip this detail thing because in future or 3 or 4 months later, after launching the FDA, I will present more detailedly. Today's the introduction lecture, so I will skip detailed things. Anyway, this product have the single type or bridge types, the abutment. This abutment have the ideal transmucosal part within the 30 degrees, And then they have the several ranks of the transmucosal part. Also, this abutment can compensate about 25 degrees tilting of implant. The cap is composed with the three, not six bore, 3 zirconia bore, and then nitinol, memorial metal inside of the cap. And then this product is a dedicated system for digital dentistry. So this cap has the role of scan body. So after put the implant and then put the abutment and scan and then send the data to the dental lab, dental lab can make the zirconia crown simply. I will pass about that. So after making the final prosthesis, you can put the zirconia crowns with the biting pores like this. There is no sound. Anyway, after biting, the talk sound can you listen, and then finish it. After, sorry. If you want to remove this crown, in case of bridge, you can eject like this, very simply removed. And then cleaned or treatment, and then you can push this crown very simply. The bite, and then 딸깍, click. Like this. So, you know, in the previous implants prosthetic systems, the removing and reattaching the prosthesis is very difficult and burden procedure. But for frequent maintenance procedure, you have to remove very easily. If the patient have the peri-implantitis or peri-mucositis, or the patient is at-risk patient, you have to control in dental clinic by the oral hygienist. At that time, we have to reduce the detaching procedure, you know. So I'll show you only one case like this. I published several report case and clinical research until now. So this published in the JPD. So many European countries like those kind of systems. So I got the CE approval already. So nowadays in Swiss and some countries imported this product nowadays. At that time, I sold my patent to one company. So this is not my product. I already sold this product. But I'm so happy because many countries want to use this product. I'm really glad. I had a better sold higher price at that time. So this patient lost second premolar. So I insert the implant, and then after healing, I put the easy crown abutment in oral cavity, and then talk and scan this abutment. If you don't have a scanner, you can take impression with silicone material, and then if you have the intraoral scanner, it's very simple procedure. If the margin located in the submucosal, subcrestal regions, but you cannot use the Jung cord or other treatment. So only you can detect the slot part. It's like the scan body. Yeah. After scan and then send the data to the dental lab. Dental lab has already the STL file, so the dental technician can merge each other and then make the final processes like this. So dentist can that it can cement this pinal process in the oral cavity with resin cement. But I heard that the American dentists don't touch the pinal processes, right? So at that time, the dental technician can attach this cap to the zirconia crowns. Yes. The pinal process delivery. Which one? This one. Yeah. This is bridge case. So sometimes the senior dentists write the conventional method. They want to take impression using the pick-up impression coping, So I made the pick-up impression coping, but I don't recommend use those kind of things. Pick-up impression procedure also make the error. So anyway, digital method is best. I think so. But like this, this is impression copying. And they take impression and make the model. I'm not recommended this one. Anyway, you are all young guys. Yeah. This is final processes. So if you don't like eject the pinal processes, you can make the small hole on the occlusion. So you can see the bigger model in this. Look at, this is a picture, this is abutment, this is cap. So after the cementation, this crown, the cap, like this, and then there is two methods to pull out these pinal processes. First thing is the heat ejector. He's using the ejector. Second thing, if you make the small hole, there is a dedicated screw. So until today, I didn't attach this one. So if you push this drive in the hole and then rotate this one like this, you can remove the pinal processes without ejection. Yeah. So according to the patient characteristics, you can change the method. But if you don't use the ejector, you have to make the hole small hole. It's the smaller than the screw hole, very small. The diameter is 1.2 millimeter. Yeah. But that processes have to have the screw hole. So that is your choice. You can see this model after my lectures. I tested and then published many articles about this. So after repeating the detachment and attachment, the retention will be maintained with a very long time. But how many times do you pull out these pinal processes in the whole life of patient? So I believe that under 1,000, I don't know exactly. If you detach these processes every 2 months, definitely 6 times per year, and then change it to the 10 years, about 60, Yeah, right? Yeah. So anyway, the retention pores is similar with the premier implant cement. That is the implant dedicated cement, right? And the Pusan. So I like the predictability. If I forced some Newton, these processes can be pulled out. That is predictability, right? Yeah. But when we cement with some cement material, we cannot predict how much pores can pull out these pinal processes. We don't know about that. Anyway, the retention pores, I made the retention pores to the 50 Newton. This is the clinical report. But it's not perfect. I think so. Every system have the limitation. So after researching this article, I don't recommend this system to the single implant in Korea because Korean like the heavy food, sticky food, and then they like the tight contact between the upper and lower tooth. So if the abutment loosening is occurred, yes, we have to remake the pinna prosthesis again. Do you understand? So after insert this abutment, and I talked about 35 Newton, but this abutment loosed. And then we retightening of this abutment, but the crown position will be changed. Do you understand? So in the bridge case, it's no problems because we don't have to make the notch on the crown, in the crown. But in a single case, we have to make the notch to prevent the rotation. But after retightening, the position will be changed, a little bit changed. So we cannot insert this pinna prosthesis. So there are two methods. First thing is I can remove this notch part inside of the crown, but we cannot prevent the rotation. So that is the limitation. So I tried to change this component with two pieces, like the implant abutment, but the structure cannot endure the heavy force. The deformation was occurred. So it's only one limitation. So when I see our result, there are some limitation of abutment loosening like this, 4 cases in the single implant. Yeah. But if we use the bridge or edentulous area, it's very good systems. I will show the Orompo systems and at the end of my slide. This is the another article. So my final goal is to reduce the component. So nowadays I'm changing the cap structure, and then now I'm combining with the abutment and picture like this. Do you know the tissue level implant in ITI? It's similar with that. So there is no gap and there is no loosening of abutment. In future, definitely you all will use the digital guide systems, guide implant systems. So do you know why my ancestor make those kind of component? To compensate the error of final prosthesis. No? If you insert implant abnormal position, you have to compensate the tilted implant, so this abutment will be needed. But if you use the guide systems, and then the guide system include the compensating factors of the tilted implant, we are not necessary to use the 2-piece implant, right? Yeah. So in future, every product will be changed like this. I believe so. In Korea, I made those kind of implant and then approved the KFDA, and then now I'm using in my clinic. Very good. But whenever I use those kind of one-body implant, I always use the digital guided systems, guided system. So I hope that JMbio will support the guide system, right? Where is it? COju? Okay. I heard that American dentists like the digital guided surgery. I heard that. In Korea, early stage the dentists like that, but the specialist or the dentists who have many experience don't use those kind of things. Burden devices to us. But in future, automatically the software will product the digital guide systems. Every dentist have the 3D printer in clinic. After push the button, definitely, obviously the love. Okay. Anyway, the surgical guide stent will be produced in dental clinics. I think so. This is another lecture. Anyway, I've done many kind of clinical research. So the survival rate is over 95%. They're similar with another system. But this system can give us the convenience in the clinical situation. If the patient are in at-risk patient, and risk situation. Okay, next thing is about another systems, Oronex zirconia systems. I will show you the four methods for making the Oronex systems using zirconia material. So it's look like the conventional build bar, right? But nowadays, according to developing of the digital dentistry, those kind of build bar can product by the building procedure, very simply. As I told you in previous lecture, slide, the patient who don't have proper embrasure space, or the patient have the wrong crown height. So those kind of patient, we have to change the pinal prosthesis form. Sometimes because of aesthetic, we have to cover the loss gum part, compensating the soft tissue loss or bone loss, right? So I inserted implant like this without surgical stent because I'm a prosthontist, so I can design, I can drawing the pinal prosthesis in my head. So I have been training, yes, to make the pinal prosthesis with by covering with the PMMA resin. Yes, I have many experience. So without using the surgical stent, I can insert the implant the proper position. What is the proper position? The depth and the screw hole have to will located in the occlusal surface like this. The hole, if the hole located in the interproximal area, it's not proper area. No. So anyway, if I insert implant properly, the procedure will be very simple. Every dental lab can make those kind of processes. No? Especially the compensating of tilting implant. In this case, I used the submerged internal connection implant. So as I told you, internal connection implant can compensate only under 22 degrees, right? So fortunately, I insert implant within the 22 degrees tilting differences. So at that time, I can make the screw or essentially a combination type pinal prosthesis with the screw hole. So and design the pinal prosthesis. This is very important guideline. This implant is whether this implant is located in proper position or not. Yeah. Is it strange? Is it strange? But it's acceptable. But if the hole is located this part or this part, it definitely make the bulky size of pinal prosthesis. We cannot compensate with fixed prosthesis. Look at these pictures. So my resident insert implant like this. So she also a prosthontist, but okay. When you see this picture, wow, the picture is parallel each other. But the dentist showed only present crestal ridge. She didn't see the pinal prosthesis. No? Although implant located in the parallel each other, and then located in the present crestal ridge, but the patient had like this in original alveolar ridge. After extraction, the bone was resorpted, soft tissue resorpted, and the alveolar bone crest moved to the palatal side. So I'm focusing to train for drawing the pinal prosthesis to my resident. So that is very important. Although we have to do the bone augmentation, it's second problem. The first point is the proper location of the implant. So although she inserted 6 implants on upper jaws, I changed my pinal prosthesis to the removable types. Do you know the resilient type prosthesis and rigid type prosthesis? What's the resilient type? That is the case is using the 2 implant with locator. That is resilient type. That permit the movement of the pinal prosthesis. Rigid type means there is no movement. That can have the similar function with fixed prosthesis, but we can remove for cleansing. So in this case, we can make the rigid type pinal prosthesis using the bar. Build bar. Build bar have the 3 function. Build bar can endure the support, vertical force, stability, and retention. Every factors can endure by the bar. So those kind of things, there is no movement of pinal prosthesis. So we can say those kind of prosthesis fixed type, non-resilient type prosthesis. So I made, this is the casting procedure. Anyway, using the cord. I casting this bar and then make the like this. So screw hole is located like this. But bar have to locate it in the original crystal ridge. You understand? When you make the bar, you have to position this bar to the originally located alveolar ridge. So it's very important. If you make those kind of bar, you can meet many side effects: fracture of the crown, fracture of prosthesis, loss of bone around it. So bar is very difficult. They have many side effects if you cannot make it properly. And then especially you have to make this proper space between gum and bar. 2 millimeter is basic. 2 millimeter. Understand? This part have 2 millimeter. 2 millimeter space. If you don't make 2 millimeter space, soft tissue is creeping, and block this space. The patient cannot push the dental pros inside of the bar. Okay, summarize. When you make the bar, you have to imagine the previous original crestal ridge. So I call this bar like the artificial alveolar ridge. Artificial alveolar ridge crest, you know. And second important thing, proper space for cleaning between gum and bar. 2 millimeter is essential. Yeah. When I heard from the many dentists, they always said that bar has many problems. I can understand. If you don't keep the regulation or general rule of bar, definitely there will be occurred many side effects. There is your fault, not bar fault. Sometimes we tend to see the present crestal ridge. This implant inserts properly to the crestal ridge, right? But the pinal prostheses have located like this, not like this. If you insert implant like this and then make the pinal prosthesis, the tongue space is smaller than original. The patient said, I'm so difficult to say. I cannot, I don't know how I can put my tongue in my house. Many patients like this, said like this. And then there will be many undercut in Barker aspect. After making the fixed pinal prosthesis, patient said to me, the food debris is accumulated in the Barker aspect. So sometimes patients said like this, I can eat, I can bite meat and snack, but I cannot bite the ramen. What's the meaning? The tongue and the cheek have to have function to relocate the food debris to the occlusal plane, like this. No? After biting some food flow in the cervical area. At that time, tongue have to how can I say? Anyway, lift the food to the occlusal surface. Especially in case of sticky food or rice or ramen, those kind of food. But if you make pinal crown like this, the tongue cannot act properly. So that makes the loss of the biting force, efficiency of biting, chewing, Chewing is not relation between upper and lower tooth. Chewing has to think about all component, upper tooth, lower tooth, cheek, and tongue movement. So we have to consider about that. So anyway, I changed the pinal process like this. This process is the fixed type. So although I made the PMMA resin, but all molar occlusion covered with the metal. This patient have the fixed prosthesis in lower jaw. The biting force is so heavy. If you remain only resin teeth, definitely the resin teeth will broke or wear. So many patients will complain to you. So in my case, I always said to patient, I don't want to see you frequently. So please help me. And then if you give me some money, I will change strong tooth. That makes our relationship is anyway far away. I don't want to meet patient frequently. So anyway, and then we can remove the palatal cover. What's the meaning of the palatal cover? What's the role? That is giving the support to using the plate. It's not increase the strength of denture, to improve the support. So this part is for denture, not rigid type prosthesis. Yeah. So we can remove this part. And then inner part always have the metal coverage. Because this process is fixed type, similar with fixed prosthesis. Many pores can transfer to this material. So inner part, outer part, you have to cover the metal. So it's not your lower. This process will make the dental lab. Yeah, you have to pay some more. Definitely, those kind of consideration make the less meeting with the patient. And then this buccal part can give the patient aesthetic aspect. Yeah. So sometimes remove part can give us many merits. If you cannot do surgical procedure like bone augmentation or soft tissue graft, so after insert implant broadly, and then you can make the fixed, non-movable prosthesis. The function is similar with fixed prosthesis. But the patient can remove every day for cleaning. So cleaning is very important. This is not my case. So now this is recording now, right? I didn't permit this case to the dentist. Anyway, this patient came to me by himself, because he felt discomfort in this spinal prosthesis. After insert implant using the digitalized method, so I called the dentist. Yes, also your patient came to me, so how can I help you? So my intention is to turn back, yes, to you. But he said that I give you every information about this patient and then solve this problem. So I got some pictures from some STL file from the dentist, previous dentist, and then I thought about the reason why this patient suffering from the peri-implantitis in this part. Anyway, this patient had the 6th implant in maxilla. So especially the dentist used the surgical guide systems. Look at this. But although he used the surgical guide system, his implant inserted like this. It's because this design was not performed by the dentist. The design was performed by the dental technician or non-specialist. I don't know exactly. So in every company, the designer is not concerned with our field, you know? Yeah. Do you understand the problems of this one? So this part make the bulky prosthesis. And then to make aesthetic prosthesis, the dental technician make the bulky size of the buccal aspect. Patient want to clean. The patient were using the Waterpick to clean this prosthesis, but Waterpick cannot go through this part because the prosthesis contact with the gum. Look at this, the debris, food debris like this. To make aesthetic final prosthesis, especially this is zirconia, and then Oron X, Oron 6. But although the implants are located in abnormal position, the dentist always see the aesthetic part, aesthetic aspect, and then made the contact between the final prosthesis and gum. If the dentist recommended the use of interdental brush, maybe the peri-implantitis frequency will be a tendency will be decreased. But the patient using the Waterpick. This bulk area make the bulk of final prosthesis, and the tight contact have some problems. According to many articles, those kind of bulky prosthesis can definitely make the peri-implantitis. We cannot clean. Dentist also cannot clean. So if you want to remove, if you clean perfectly, you have to remove the final prosthesis. But to remove the final prosthesis, you have to remove every hole resin, every hole screw, and then detach the final prosthesis and clean, and then you have to do one more time, the same procedure. Time-consuming procedure. Do you know hybrid dental restoration? Hybrid dental restoration is similar with implant hybrid prosthesis or bone anchored bridge developed by the Brennemark company. So although the pinal prosthesis used the PMMA, but the cervical part have to make the enough space for cleaning. Yes, they recommended to make the big enough space between pinal prosthesis and gum. Oron X, Oron 4 with zirconia prosthesis have to have the same concepts of this one. If you use the screw retained prosthesis. No? This is another case. The dentist insert implant in the present alveolar crest ridge. But the dentist considered about the cleaning, so to make the big enough space of the cervical area. Dentist did not cover the residual gum, but this patient came to me. Food debris accumulated in the buccal aspect. Whenever he eats something, he have to clean every time. So this makes also another problems, right? The dentist considers the cleanability, but the patient feels the discomfort of tooth accumulation and non-aesthetic. Especially the patient complained about the less support of lip. So this part is put inside. So because of that, he had the deep wrinkle around the mouth. So dentists have to consider everything, aesthetic, facial, and then cleaning. So I said to my son, you never be the dentist. If you want to work in medical field, you had better go to the medical school. So my son said to me, I don't want to study. Anyway, so this is from the website. So in America website. So I don't want to say about the product name. Anyway, this product also made the bar inside of the to the implant, and then make the zirconia pinal prosthesis like this. But covered everything for aesthetic aspect. How can we clean this one? Anyway, in the website, they recommended to use the water pick. But is it possible to clean perfectly? No. Yes, no. And I think that this system was very good. I think that because the concept is very good. So anyway, the dentist build the bar with the CAD/CAM software, CAD/CAM systems, and then make this very simply. And then separate the bar in each implant because to compensate the implant angle differences. But this process is also fixed time. We cannot remove. The patient want to remove the prosthesis, they have to go to the clinic. No? So anyway, this system, so I developed this system. So anyway, to be frank, it's not developed. For a long time, my senior dentist have been using these systems already. No? Anyway, I developed the dedicated attachment for zirconia. This part, I developed this part. This bar can made by the CAD/CAM software, CAD/CAM technique nowadays. So anyway, in Oron X systems, we have to consider cleaning, fractal, 그다음 and 한국말 같이 나오네. So anyway, we have to consider those kind of factors. So I divided the treatment concept like two. The first thing is for overdenture. Second thing is zirconia overdenture. You know, the function is similar with the fixed prosthesis, but the patient can remove if they want, or dentist can remove very easily. Yeah, especially the location of implants is abnormal. We can compensate the attachment or screw holes direction can be compensated with bar. For example, we insert like this, but after making bar, and then we make the hole parallel each other. You know, so this system has many merits, those kind of things. So the screw hole size is the international standard. So if you use the locator or kerator systems, if we want to add talk system that was developed by me, every hole has the same size together, each other. Okay? So, but the overdenture is for the severe bone loss cases. So the gum part have to cover the residual ridge perfectly. You know? But in zirconia cases, you have to consider about the cleaning. This is not overdenture. The patient cannot necessarily to remove every day. Understand? So in my patient, I generally recommended one time per month or one time per 2 weeks. If you need some cleaning and then remove this part and then cleansing and then put inside again by yourself. But the patient cannot remove this one. This has a high retention, so some patient cannot remove this one. So at that time, about 2 or 3 months, per 2 or 3 months, you have to visit my clinic, and then my hygienist will remove this prosthesis simply and then clean again. You know, so some different procedures. So I brought 4 cases. That is real patient cases with zirconia. You can see this cast after my lecture. So especially nowadays, developing the CAD/CAM digital technology, we can design very simply in CAD software. It's not your job. After you're taking impression, the dental technician can design like this. But you have to teach them. You have to notice the important thing in clinical aspect. You have to remove this part. You have to make the workspace in this part. You have to indicate. You have to talk to them. Okay, so it's very important. So after design the final processes and then using the cutbacks software, you can make those kind of bar very simply. If the picture tilted within 22 degrees, you can make one body bar system. There is no abutment. Connection part and bar part can mill simultaneously, and then you can get the one body bar in clinic. But if there is some problems in location or there is some big tilting in implant, you can use the custom abutment among this one or two things made with the custom abutment, and then another thing using the one body. Understand? Or you have to use the multi-unit abutment. Anyway, those kind of things will select in dental lab. Yes, after surveying, you know. So nowadays I'm teaching. I'm sorry. Anyway, the dental labs about these concepts. So after getting the final model, they can survey the picture tilting angle and then select a proper treatment planning. And then after you are confirming, the final process will be made. This is the implant. These are for attachment or screw. So I will show 4 types of oromneck system at the end of my lectures. So anyway, they all have the same diameter, international standard. So the choice is your lower, like this. Using the 5-axis milling machine, the titanium disc can be milled with the right bar, those kind of bar, very simply. After milling, and then you can insert any attachment, locator or editor. If you don't use the attachment, you can insert the screw directly. So I will show the cases. This attachment is for zirconia overdenture. Yeah. So this editor attachment don't have the function of support. I made some movement and then pivoting movement, because every pulse have to prevent by the bar, and this attachment have the only the retention, for retention. Yeah. But the difference between locator have 3 function. The metal cap have the function of support, stability, and retention. So sometimes we can see the severe wear of the plastic part. But as I told you, this bar system is not resilient type. This bar is rigid. There is no movement. Yes, that quality have to make in dental lab. It's not your lower, but you have to check the rolls are proper in the bar. And then this part only retention. So the size is very small. Yeah. I compare with the size between locator and editor systems, but in America, many patients don't have heavy bite, right? So I believe the patient can have the locator instead of this one. Okay, look at. I want to show some cases about this part. So this system is efficient in the partially edentulous patient, not fully edentulous patient. So for example, the dentist insert implant like this. I never blame him. I never blame the dentist, because sometimes dentists can insert like this. Many dental general practitioner cannot perform the perfect bone augmentation. So within the present bone, they can insert like this. But we can recover this problem to the final processes. So after taking impression, and then make the artificial ridge with bar. The implant is located in the palatally, but I make the bar to the original alveolar ridge part. No, it's very important. And then I checked the space between the bar and lower teeth, and then make the zirconia final processes like this. So this is not resilient type processes, as I told you. So this attachment can attach in the dental lab, not necessary to attach in the clinic. But I like attach by myself. So using the resin cement, this is zirconia. So you have to use the resin cement with MDP. Do you know MDP? So anyway, the zirconia bonding mechanism is different with the porcelain bonding mechanism. So to get the chemical bonding, you have to select the MDP containing resin cement, MDP. That is phosphoric ester monomer. So that increases the bonding between the zirconia and then some attachment. So MDP is not commercial things. MDP, the patent of MDC was released already. So every company are using the MDP for zirconia bonding. So you have to check the MDP component. So this is final prosthesis. You have to cover labial part for aesthetic, but you have to make enough space in the palatal space. So without removing these prostheses, the patient can clean by themselves with water pick or interdental brush, right? So I recommend this patient to remove these prostheses every 2 weeks. Every 2 weeks, he removed this part and then clean and then doktak one more time. Yeah. This is a fully edentulous patient, but like this. So this bar, and then the patient can remove these prostheses by themselves, and then put the prosthesis like this, with biting pores. Okay. So the adjusting of the retention pores according to the number of the attachment. So generally, in the dental lab, there's 3 screw hole. But according to the patient pores, you can insert only 2 or only 1 or 3. Understand? Yeah. So anyway, I made a patent the form of this oral neck systems. So Ostem implant is spreading this oral neck systems in Korea. In America, JMbio will spread this one. So I invited from the JMbio. Anyway, I know in America there is a Hyosen, it's the branch company of the Ostem, right? So, but in Hyosen there is no research center, so I regretted about that. So anyway, this product will be spread in JMbio. Mr. Ju, go outside. Yeah. Okay, only 10 minutes remain. Using these procedures, we can reduce the visiting time of patient. So I will show the method how to reduce the visiting time using the digital method. So this patient had been using the overdenture like this. The young patient have the oral cancer in the mandible, and then some part of removal of some part, and then make like this 10 years ago from another doctors. So anyway, the general dentist report to me. So because there are so many side effects, fracture of the overdenture, resin overdenture. So, and then we cannot buy the clip in the market recently. So the patient want to rigid type restoration because there is denture. He have to remove every day this denture and clean before the sleep, and then when he sleep, he pull out the denture and put in the water, right? So he's young guys, so he want to fix the type. But when I analyze the position of implant, it's impossible. So he has so severe bone loss broadly. So I changed it, my treatment concepts like this. This is side effect of the previous overdenture. Take impression, burst visit. This is burst visit. When the patient comes to me, I take impression. If you don't prepare the customized tray, you can use the plastic tray, making the hole. You have to remember, this process is not resilient type. In case of resilient type, you have to take impression perfectly with the ideal soft tissue form. No? But this patient is rigid type. Not necessary to take impression the vestibule or other things. Only you can take impression, pick up impression. Okay, first visit, you take impression, and then like this, and then send to the dental lab. This patient have the natural teeth already, remained some teeth, so we can take a bite. This bite is not final bite, not perfect bite. This bite is for arbitrary bite, for temporary, or designed bar, okay? So this patient have the only left side teeth, so I make the frame with the pattern resin for enhance the strength, and then reduction with bar, this part, and then retake one more time. This bite is arbitrary bite. This is birthday. Birthday, you can take impression and take bite and then send the impression to the dental lab. Okay? So dental lab, this is PAPO systems. So if the patient cannot have the proper occlusal plane, when you take impression, you can put the PAPO systems in the tray. So it showed the occlusal plane. I will show you next time after this lecture, okay? So anyway, the dentist have to give every information to the dental lab. So in lab procedure, this is lab procedure. In dental lab, dental technician mount the cast in the software and then design the bar like this, and the milling, and then design the temporary. So every software, for example, exocad or 3Shape, have the design tool for overdenture. So dental technician can modify this tool to the temporary. So this procedure is the high pitch precision, improve the precision of the temporary prosthesis and bar. Anyway, okay, replicated the bar shapes, and then the dental technician can make the temporary prosthesis, and they design the prosthesis. In second visit, from the dental lab, I can get the bar and temporary. So you have to check the proper form. This temporary and bar have the proper form for cleaning or aesthetic or bite. Everything you have to check using the temporary. This is made bar made, and then this is PMMA temporary. This temporary can use the biting registration. The patient want to use this temporary for 1 month or 2 months. You can deliver. Anyway, you have to check the palatal part, lingual part. There have to be made the proper space for cleaning. It's very important. And buccal aspect can cover the gum slightly within the aesthetic requirement. Second visit. This is second visit. put the bar in the oral cavity, and then I took the X-ray, the assessing to assess the pitness of the bar. Somebody said to me, "Oh, okay. How about using the intraoral scanner when I take impression?" But in case of cross arch edentulous case, I recommend using the pickup impression. So intraoral scanner has some errors in this part, because this cranium is moving, the lip is moving, so software cannot match the data together. So they make some errors in this part. So, for example, this part edentulous patient can use the intraoral scanner, but crossed arch case is very dangerous. This is not making the denture. We have to make the precise prosthesis, So pickup impression is very important. So second visit, I check the bar accuracy, and then occlusal contact point, and then lingual part space, and then try to cleaning by the patient. At that time, I ordered buying the interdental brush or water pick. So I trained the cleaning method. I believe you all have the oral hygienist, So right? So oral hygienist can clean and educate the cleaning method in this time. After assessing the cleaning ability and then patient response, and then take impression, take bite impression using the temporary processes, and then send to the lab. This is second visit. And then in the dental lab, insert the attachment, and then tightening, and then duplicate the temporary crown to the zirconia directly. And this is zirconia. We adjust the occlusion already. We take final bite in using the temporary already. So within 3 visits, the patient can get the final prosthesis. It's not perfect. After getting the final prosthesis, you have to adjust occlusion some more. That is the role of dentist, right? So this is rigid type prosthesis. So attachment connection can be done in dental lab. But in my case, I like bond this attachment directly by myself. So anyway, in clinics, I attach it like this. This patient want to lower retention of the prosthesis. He don't like the heavy pores. So I reduced the attachment to only two attachment. Instead of editorial attachment, you can use the locator. Yeah. This is final prosthesis. When I see the patient face, smiling face, I'm so satisfied. So this patient have the aesthetic prosthesis. This patient have the fixed prosthesis like removable denture with zirconia. Without everyday pulling out, the patient can clean. Yes, not perfectly, but he can do it. So after 2 weeks later, remove the prosthesis, I can see the food debris inside of the final prosthesis. At that time, and then clean perfectly and resetting. Cleaning is very important, I think so. Full mouth case. This patient had the 6th implant at the first time. But when I see this patient, he lost 1 implant in this part. So I decide to make the Oronex zirconia. So first day take impression, pick up impression taking, and then arbitrary bite taking using the bite tray. As I told you, this bite taking is not final bite taking, arbitrary. So using the bite tray, do you know this bite tray? Yes, disposable bite tray. And then remove this part. And then mix the body. And then bite. You have to induce the CR point with the two hands. Okay? And then stopped with the proper space. This is not final bite taking, It's for temporary, for design of bar. And this patient had the poor edentulous. This patient was poor edentulous patient, so I attached the pop-ball systems. So with the bite-taking silicone material, you can attach this pop-ball system. So this part indicates the interpupillary line. And then this part indicates the campus line. So if you have intraoral scanner, you can scan this part directly and then send the data to the dental lab. Dental lab has already the STL file of the pop-ball components and then merge each other. Or if you don't use the intraoral scanner, in dental labs, dental technician can pour the gypsum following this plane. When you pour in the gypsum, the surface of base of gypsum is parallel to this pop-ball. Yeah. I will show the sample at the end of my lecture. So at the first time, I gave many information to the dental lab. Pick up impression, and then arbitrary bite, occlusal plane, midline, lip support. When I adjust this bite tray, I can adjust the lip support. So in dental lab, dental technician can design the bar and temporary like this. So I can get those kind of, this is temporary. So I can get the bar and temporary in the dental clinic. So this patient separated with two pieces because there are some differences in angulation. So there is no problems. 3 splinting, 5 splinting, anyway, but you have to splint on only 2 or 3 implants. It's helpful to maintain the proper stress distribution. In the clinic, I adjusted the occlusion and the shapes, and then discuss with the patient about the appearance. And then if I need some add of labial part, I'm brushed on technique. I'm using the brushing technique, and I added the resin in this part, and I adjust the incisor line. I adjust the occlusion, and then scan. I have intraoral scanner, so I scanned the temporary, adjusted temporary, and the intraoral cavity scanning, and then send the data. Dental lab duplicated the data. So if you have intraoral scanner, you can reduce the sending time to the dental lab, the model. You can send this data directly by the email. And then this product can be received at the third time. And at the third time, I attach the attachment in this part. So I removed the palatal coverage because this prosthesis is fixed type, non-resilient type. So not necessary to cover. And then this part is only for aesthetic, not giving the support. This is different with overdenture. You have to remember. Yeah. So I try to smile with the patient, and then if the patient don't make the gummy smile, I reduce the baccarat aspect, pharynging. Okay, this is the conclusion. So anyway, if you can insert implant properly means, proper position means the screw hole located in the occlusal surface. And then the crown rings have to have proper ratio with the picture length. And then you have to remember the emergence profile and transmucosal part. You have to remember 3 millimeter, 2 millimeter. I remember? Okay. Do you remember? Okay. So at that time, you can make the fixed prosthesis. But if you don't make the proper fixed prosthesis, and then the implant implants are located in abnormal position, you can change the prosthetic procedure like this. It's not burden, it's not difficult. After taking impression and discuss with the dental technician, So, like this, you can change the procedure like this. I will show these cases, these last cases. Okay. Okay. Our hospital's surgeon insert the implant like this, 4 implant. And this patient had only 4 implant in lower case, so I asked additional 1 more implant. So at that time, I said to my surgeon, wherever you can insert implant, please insert implant. But you have to consider the AP spread. That means anterior part and posterior part spread is very important. You make the spread between the anterior part and posterior part, you can make the fixed type prosthesis, not resilient type. There is no movement if make the spread of the anterior part and posterior part. So take impression, upper and lower. And then I transport to the occlusal plane using the PAPO system. At the first day, take impression and then take the occlusal information into popular line and campus line, parallel with the PAPO systems. And then this bite can transport to the dental lab. So in dental lab, dental technician can make the cast like this. This abutment is old abutment, used abutment. Unfortunately, I couldn't remove this abutment because of breakage of screw hex, right? Hex? Okay. So I decided to use these implants for cemented type and this implant for screw type. Those kind of things we can say combination type prosthesis. Some implant retained by the screw, some implant retained by cement. There's no problems. And then this implant using the implant dedicated cement, not permanent cement. Whenever you want to remove the bar, you can remove. So the pinal cementation is not recommended. So after binding the model, and then when you pour the gypsum, you can follow this line with this base. So after removing this part, the base of model can indicate the occlusal plane. Understand? Yeah. I believe you all understand about that. You are genius. In Korea, my students cannot understand. Do you understand? Really? Okay. If you have the facial scanner, it's not necessary to use this one. Because in using the facial scanner, you can detect the campus line and occlusal plane. And then this model can merge with the facial scan data and the CD data. So now that I'm using the ray scanner, so it's very easy to get the occlusal plane without PAPO, using the PAPO. So I'm so sad because I cannot sell these PAPO systems. This is my joke. Okay. So when you pour the gypsum, you can adjust the base of stone to the pot bowl, and then the midline, and then everything you can adjust with the model. After remove the tray, the model base can indicate the occlusal plane. If you have an intraoral scanner, you can scan the upper and lower data. And then you can scan the pot bowl directly. This reference is for merging of the STL file and then scan file. So you can scan very simply and transport to the software this information. Not necessary to scan everything. Only you can scan only reference point. Yeah, I will skip. Okay. So after mounting this model, I designed the final processes. At that time, I felt the upper thing is the proper to make the fixed processes. That means the implant is located at the not proper, but acceptable location. But in lower case, there is no answer. So I decided to make the bar oral next type. In upper case, I will make the easy crown overdenture, easy crown oral neck systems. So after making the bar separate, because the compensator pass, and then in upper jaw, I attach the easy crown and make them vertical dimension. So this occlusal limb made by the occlusal plane, according to base of the model, So if you use this procedure, you will be surprised, because whenever we adjust the occlusal limb, it's very burden, difficult. We have to melt everything, but occlusal plane is the upper jaw's occlusal limb indicate the occlusal plane. So you can adjust the height of the occlusal limb, not necessary to tilt or not necessary to melt on other things. And bite the code and then design the final processes. So this is temporary. This is not ill-fitting processes. I designed like this. I will show the design file for cleansing. And then upper jaw is using the easy crown systems. Lower thing is the bar oral neck system. This is temporary. So this is temporary. So I maintain about 1 month using using this temporary processes, and then I checked the gum health and then the cleaning ability of patient, and then patient satisfied about this one. But when I removed the final process, I can see the food debris and then residual cement. So I adjust the design some more. In this case, I decided to reduce the buccal range. Because of the bulky size of buccal range, the food can be accumulated. So I reduced it like this. So left one is temporary. After assessment, the patient cannot clean properly, so I reduced the buccal range with accepting the patient opinion. So this patient is 86 years old. So when he smiled, we cannot see the gum area. So I can reduce those kind of things. This range. So this is easy crown and then bar. Then the upper and lower processes. Upper and lower. Upper and lower. Left thing is this side is upper and this is lower. My design file and then pinal prosthesis. This margin, this discrepancy is not ill-fitting. When you see the design file, I made like this. Yes, with intention, no? Yeah. So I can see the exact formation of the gingival form. So this 2 millimeter is very important. Yes. So if the patient have the good ability of cleansing, I can cover this part. But because of age, I cannot cover. Upper side also made about 2 millimeter gap, but this part have to cover because of aesthetic. So I used the easy crown systems for convenience of removal of prosthesis. So I educated, I trained, I taught the cleaning method to the patient. Okay, it's rear pinal prosthesis. Oh no, so I have remain one more cases. So I will summarize, I'm sorry. So I will show you four category of the oral neck systems not using custom abutment. You always think that oral neck system have to use the multi-unit abutment and then zirconia, right? But I'm not mentioning about that. That is the conventional method. But this is more aesthetic and then retrievability prosthesis. So first thing is bar and locator attachment. You can use the PMMA denture or zirconia. The second thing is bar and adductor attachment. But this attachment is not approving from the FDA until now. So 2 months later, you can use it. 3 concept is easy crown system. To use this easy crown system, the implant have to locate a proper position, acceptable position. You know? Yeah. So easy crown and zirconia. So this process cannot remove by the patient. Dentist can remove this one. This one can remove by the patient or dentist. Yeah. Overdenture have to remove every day. But this one have to remove 1 or 2 times in a month. Yeah, this is discussed with the patient. Yeah. This one, you can remove one time in or 2 or 3 months. Yeah. According to the ability of patient, you have to choose the regular checkup. Fourth is the milled bar and zirconia hybrid processes with screw. If you want to use the attachment, you need the about over 12 millimeter space, edentulous space, because you need the space for attachment, right? But there is no space for attachment, or you want to use the fixed processes, you can use the screw directly. What's the merit of this? Look at this case. The implant location is terrible, you know. But you can compensate this implant pictures tilting with a bar, and then you can make the parallel screw hole on the bar. You can locate the whole screw hole in the occlusal surface. You know, it's more acceptable, easy to remove the pinal prosthesis. So I show the last case, the real last case. I'm sorry. So he had only 4 implant. So I insert implant by intention. I tilted the implant to get the spread of AP spread. Mental foramen. So if I insert the right implant like this, my spreading is only this one. But if I tilt it with intention, the implant, I can get more spreading area of implant, you know? and then remove the original previous prosthesis, and then pick up impression like this, and design the bar. You can separate the bar, and then this part fixed, and then last one, there's some problem in implant location, so I cannot make the bar. I cannot fix each other, so I separate. Then designed the spinal prosthesis, and this spinal prosthesis, and then look at this. This prosthesis cannot remove very easily. So you have to many effort to remove this part, although I make the parallel screw hole, you know. So this bar have the margin. Lingual and so it's similar with custom abutment. But to make a parallel screw hole, I made this bar, and then this bar have the function of splinting of the picture. You know? So, and then make the whole screw like this. This like this. This one. Look at the Barker aspect. There is the margin. Without remover, this prosthesis, the patient have to have the ability of cleaning. Each maintenance is to focus. Like this. So this is very simple cases, but according to the patient condition, the treatment planning will be different. Sometimes dentists want to those kind of prostheses, but dental technician or another dentist said like this, it's some problems. When the patient smile, the patient have the black space in this part, so it's not aesthetic. So anyway, compensating the patient opinion and dentist opinion. Okay, thank you very much.